diabetes is actually a risk factor for a condition called peripheral artery disease. And Dr. Fernandez, can you briefly explain to us what PAD is?
Sure. So peripheral arterial disease is a condition where a patient's had high blood glucose levels or high cholesterol, in particular if they're a smoker, that causes atherosclerosis or narrowing of the arteries in the lower extremities or the legs. There's a little bit of a difference between the patients that have diabetes and those that don't have diabetes. The patients that have diabetes, the atherosclerosis in the legs, or the PAD, tends to be a little more diffuse, and it tends to affect primarily the smaller blood vessels, both in the lower leg and in the foot, which then makes it the complication a little more difficult to treat, either surgically or interventional.
We're going to talk more about that, but I always find it helpful to have a 3D image of what we're speaking about. And Dr. Fernandez, we do have a 3D image of an artery in the leg with atherosclerosis. And can you further explain to us what is happening here and how this causes a leg pain?
So sure, this is a simple schematic of a patient with this is a normal artery, if you will, up here, and then one here that's affected by atherosclerosis. And when you're seeing this, is the plaque begins to cause a narrowing in the blood vessels, and progressively over time, this plaque may continue to narrow, or the plaque is also a very dynamic problem. It could actually become more inflamed, the plaque can rupture, causing a thrombosis and complete clotting of the blood vessels. So this is something that happens in a very dynamic fashion. As you can see, something like this would prohibit normal circulation of the oxygen that goes down to the tissue, to preventing, for example, a foot ulcer from healing adequately.